So I will go back now to the bacterial diseases in aquaculture. So again, when we talk about the common bacterial pathogens that affects the aquaculture, so these are the common bacterial pathogens affecting the aquaculture industry. So we have the Aeromonas hydrophila, A. salmonicida, salmonicida. We also have the Vibrio species, Edwardshella, Ectaluri, Edwardshella tarda, and the Streptococcus species. So that is according to our Merck Veterinary Manual. So for the approved forms or for the treatment of the common bacterial pathogens, we have the approved forms of oxytetracycline and Dromet. Now, this can be used extra label under the supervision of a veterinarian. We also have the Fluorophenic Oil. The brand name is Aquaflor. This is considered to be the only drug approved for use against streptococcal infections in freshwater reared warm water finfish. So approved withdrawal periods before harvest must be followed when used in food fish. So just like in livestock, just like in poultry, when we are going to use antibiotics or antibacterials in aquaculture, of course, we are also going to follow the appropriate withdrawal periods. We also have vaccines. So vaccines are available for a number of bacterial pathogens, and these are also species specific. So there are certain type of vaccines which are specific for a certain type, of course, of diseases, and this is indicated for a specific species of fish. So in the year 2017, the FAO, or the Food and Agriculture Organization of the UN, was able to draft a list of the major bacterial diseases that affects the aquaculture industry in the world. So this presentation was a product of a workshop which was conducted in Italy in the year 2016, and this was presented in India in the year 2017 by Olga Henin. This is from the FAO. So again, the list of the different bacterial diseases that affects the aquaculture industry was drafted out of a meeting that was conducted by FAO in Italy in the year 2016. So there are different criteria that was used for making the draft list of the most important bacterial pathogens in aquaculture. So these are the different criteria that were used in order to come up with a list of the most common bacterial diseases affecting the aquaculture industry. So the first criteria used was the economic importance of the affected species. When we say economic importance, that is the how the population or how the consumers uses that particular species of aquaculture species. Another is the socioeconomic impact of that particular pathogen towards a particular aquaculture species, and also the zoonotic potential of the pathogen, whether that particular pathogen can be could be infectious to the public, the consumer. We also have here the different bacterial diseases of aquaculture was also categorized according to whether they are present in cold regions, temperate regions, and tropical regions. So the Philippines is a tropical region. It has a temperature of, it ranges from 20 to 37 degrees centigrade. For those areas having a temperature of 5 to 25 degrees centigrade, so they are considered to be temperate, no temperate region. And 0 to 15 degrees centigrade, so they are considered to be a cold, no cold region. So the different bacterial diseases of aquaculture were categorized according to whether they are present in the cold countries, temperate countries, and tropical countries. So these are the most important bacterial diseases in aquaculture listed by the FAO in the year 2016 and presented in the year 2017. So these are categorized according to two. We have the gram-negative bacteria and the gram-positive bacteria. For the gram-negative bacteria, we have the Vibriosis. So under this, we have the Vibrio angularum, Harveyi, Parahemolyticus, Vulnificus, and the Photobacterium Damsel. So the red ones indicate that these particular pathogens are important for tropical regions, just like the Philippines and the countries in Southeast Asia. So they also belong to tropical regions. For the Aeromoniasis, so the most important pathogens in the tropical region that belong to these species are the Aeromonas caviae, Aeromonas hydrophila, Sabrea, Veroni, and Jande. We also have the Edwardsiellosis. Now we have the Edwardsiella angularum, Ectaluri, Lisida, Tarda, and the Yersinia rockeri. We also have the Pseudomoniasis, Flavo, Bacteriosis, and for the gram-positive bacteria, we have the Mycobacteriosis, and these are the different species that causes Mycobacteriosis in aquaculture. Streptococcosis, these are the different species that cause Streptococcosis in aquaculture. We also have the Renibacteriosis and the infection with anaerobic bacteria and infection with intracellular bacteria. So again, those names that are indicated in red, they are considered to be important for tropical regions. So starting with the Vibriosis, so Vibriosis is considered to be one of the most prevalent fish diseases caused by the bacteria belonging to the genus Vibrio. So in milkfish, this particular bacterial disease is manifested by hemorrhage, and inflammation of the skin of the fishes. The etiology of this Vibriosis is the Vibrio angularum serotype 1. And for the characteristics of this bacteria, this is a gram-negative. This is rod-shaped. And it has bipolar staining. And it is motile in fresh suspensions in sterile saline solution, 0.9%. It occurs primarily in fish, in shallow brackish water, particularly in late summer, as water temperature exceeds 50 degrees Fahrenheit. So this situation is of greatest importance to commercial culturists raising salmon in pens. So for the other species affected by Vibriosis, caused by Vibrio angularum, this is mainly affects the marine culture of salmonid and perciformis fish. And this also occurs in cultured and wild marine fish in salt or brackish water. So for the clinical manifestation of Vibriosis in red groupers, so this is manifested by inflammation and loss of the scales of the fish. So Vibrio anguillarum was first described in 1909 as the etiologic agent of the red pest of eels in the Baltic Sea. So an earlier report from the early 1800s describing epizootics in migrating eels implicated a bacterium named Bacillus anguillarum. So the pathology of the disease and the characteristics of the bacterium in these two reports suggested that the etiological agents were the same. So vibriosis in salmonids, in Chinook salmon with lesion on the body. So this is the clinical manifestation of vibriosis in salmonids. So this is the characteristic of the Vibrio anguillarum. So they are halophilic groups of vibriosis. So when we say halophilic, this particular bacteria survives at different salinity. So they are present in seawater as well as in brackish water species. So it is also able to survive in seawater for more than 50 months. And there are more than 20 different serovars of Vibrio anguillarum, designated as O1 to O23. So serovars O1 and O2 occur worldwide and are the most often found in connection with diseases in fish, particularly in salmonids and species of codfishes. So for the age and the size of the fish that are mostly susceptible to vibriosis, so all age classes are susceptible, and mortality is higher among the young fry. Obviously, the economic damage is greater when larger growing bass are lost. For the clinical signs, the external and the internal signs of vibriosis, so this includes red spots on the ventral and lateral areas of the fish. There are swollen and dark skin lesions that ulcerate and release a blood exudate. So there are also corneal lesions, initial opacity of the cornea, followed by ulceration and avulsion of the orbital contents. So there is the eversion or avulsion of the eye contents. So however, in acute and severe epizootics, the course of the infection is rapid, and most of the infected fish die without showing any clinical signs. We also have other lesions of vibriosis. So there is hemorrhagic appearance of the skin and fins. The belly is distended. There is an inflamed anus, and there is exophthalmos for the avulsion of the orbital contents. For the internal clinical signs, there is a pale liver with petechiae and splenomegaly, distended intestines. Often there is excessive visceral fat due to chronic overfeeding, and the swim bladder is frequently distended. Hence, many of the moribund and dead fish float on the surface. So these are other non-necropsy findings of vibriosis. So for the sea bass fry, so they suffering from vibriosis, so they exhibit deep necrosis of the trunk, and the tail, peduncle, as well as the caudal fin. So that in this particular necropsy finding, the caudal fin, and the peduncle of the fish were already necrotizing. Cannibalistic activity against the sick fish by their cage mates may also predispose to such lesions. So for the diagnosis of Vibriosis is of course mainly based on the clinical symptoms, the necropsy finding, as well as the isolation of the bacteria on agar plates. Serologically, it can also be done by means of a rapid agglutination test kits. So this is the test kit that is available for detecting the Vibriosis in fish. So there is the agglutination, no? The test would require agglutination, so you are going to use in here the serum. This is also another mono aqua diagnostic kit that can be used to detect Vibriosis. This is the biochemical test, biochemical characteristics of the pathogen of Vibrio anguillarum. For the prevention and control of the Vibriosis, so control is best achieved by maintenance of water quality, good husbandry, and low stocking densities. So when we say water quality, that refers to the available the dissolved oxygen in the water, pH, as well as the presence of organic material in the water. This is not, however, always possible, and where outbreaks occur, treatment with antibiotics is the only option. So in areas where a disease is not endemic, it is possible to exclude the causative agent by a legislative policy, such as restriction on the importation or the movement of live fish or eggs, and slaughter and disinfection in infected fish. So the restriction on the importation and the movement of fishes is under the biosecurity measures that can be taken by a particular place or a particular region in order to prevent the entry and the spread of this particular bacterial disease. These are the treatment that are available for Vibriosis. So daily administration of antibiotics. It can be mixed in the feed for 10 days and usually effective to eliminate mortalities. So the antibiotics that are being used are oxytetracycline, lumikin, and oxalinic acid. And there is also the potentiated sulfonamide, trimethoprim plus sulfadiazine. So ever the disease often reappears in about 2 to 3 weeks post a seemingly successful or past a seemingly successful therapy. So these are the external signs of Vibriosis on groupers. So there is a discoloration with lesion of the skin and also the fins. There is also the hemorrhage on the pectoral fin. So for the prevalence, this is from Malaysia. This particular study was conducted in Malaysia. So again, this letter A here represents the discoloration of the skin and the fins. Letter B here represents the loss of the left side of the fish eye, due to exophthalmos. And letter C represents the hemorrhagic lesions on the pectoral fin of the groupers. For the internal lesions of the Vibriosis, it shows blood tinged no acidic fluid. We also have the enlargement of the spleen and the discoloration of the liver. So these are just some clinical signs, but these are not confirmatory, because confirmation of the Vibriosis infection can only be done through isolation of the bacteria, as well as the different serological test, agglutination test, and the biochemical test that can be done in order to fully identify the causative agent of the Vibriosis. So this is also another slide showing the summary of the Vibriosis in terms of its host range. So it can affect more than 50 fish species of freshwater and marine fish. So again, this particular bacteria is halophilic, so it can survive in freshwater, brackish water, and marine water. So the species that can be affected are eel and the sea bass. So we also mentioned earlier the salmonid species that is also affected by Vibriosis. For its geographic distribution, so this is a global pathogen of fish, and a diagnosis is done through bacterial isolation and different diagnostic kits. Management, vaccines are available for this type of bacterial pathogen, and it has no zoonotic potential. We also have another species of Vibriosis, the Vibrio harvey, which can cause a luminescent Vibriosis. For its host that are affected, so it can affect the crustaceans, culture of shrimp, larvae. You have the grouper, the snapper, and the Asian sea bass. These are all present in tropical regions. So the one in red are present in tropical regions. So they are distributed in warm regions and seawater environment. For the diagnostics, so this is through uh, bacterial culture. Management, eggs are colonized by Vibrio harvey before hatch. So it is important to remove the spawners and rinse the eggs. So the spawners are the one that are hatching the eggs. It is also of no zoonotic significance. We also have the Vibrio Vulnificus. So this particular Vibrio species affects eel, anguilla species, and other marine fish. This is distributed in warm regions, seawater. For its management, apply good hygiene, avoid seawater at eel farms. And for its zoonotic potential, it has a zoonotic potential, particularly the biotype 1 and the biotype 2 of the Vibrio vulnificus. So for its management, it is specified here that the seawater should be avoided, not eel farms, because this can cause the transfer of the pathogen from the seawater to the freshwater. Another type of vibriosis is the um, Alivibrio salmonicida, which can cause the cold water vibriosis. So these are the different hosts of the Vibrio salmonicida, as well as its geographic distribution. So these are mainly found in America, and in Europe. So there is also a vaccine available since the year 1987, and it has no zoonotic potential. So this type of Vibrio species is present not only in cold environment. We also have Vibrio species causing is what we call Pasteurilosis, or the Pseudotuberculosis in marine fishes. So these are the species of marine fish that are affected by this particular Vibrio species, Photobacterium Damsel. These are the geographic distribution of this particular species. And for the management, lower water temperature to less than 18 degrees centigrade. There is also a vaccine for the Photobacterium Damsel, PCCida. It has a zoonotic potential, meaning it can infect the caretaker that is involved in raising the marine fish. Again, the one in red shows that this particular species is this particular pathogen can infect the fishes that are present in tropical regions. So we also have here the Vibrio species that affects the shrimp industry, particularly the Pineus vaname, Pineus monodon, and the Pineus chinensis, as well as other shrimp species. So this is present in tropical region. Now the Vibrio parahemolyticus, which causes an acute hepatopancreatic necrosis disease in the shrimp industry. So this is OIE listed disease. So this is present in tropical regions, including the Philippines since the year 2009. So Malaysia, Thailand, Vietnam, Mexico, and China. China is, of course, in part a tropical country, and Vietnam, Malaysia, and Thailand, and the Philippines are in Southeast Asia, and Mexico is, of course, another tropical country. So for the management, so this is an OIE listed disease, and for the zoonotic potential, it is not indicated to be of public health significance. Another bacterial diseases affecting the aquaculture industry is the Aeromoniasis. So these are the species of Aeromonas that affects the fishes. We have the Aeromonas caviae, Hydrophila, Sobria, Veroni, and Gendae. So the motile Aeromonas species are present in tropical regions, and these include the Aeromonas hydrophila. For the host range, In tropical regions, it affects catfish, tilapia, pontius, robo, and other cyprinids. It is global in distribution, and this particular pathogen, bacterial pathogen, is considered to be um, opportunistic type of bacterial pathogen. For its management, avoid other causes of disease. So this particular bacterial pathogen can be present together with other bacterial pathogen. And for its zoonotic potential, it has low zoonotic potential. So this is the clinical manifestation of Aeromoniasis in Pontius in Ruho in India, as caused by the Aeromonas hydrophilus species. And this is the channel catfish, Ectalurus punctatus in USA, that is also a potential host of this particular Aeromoniasis. So we also have the Aeromonas species affecting the salmonids, marine fishes, and the marine fishes. And this particular Aeromonas species is the Aeromonas salmonicida subspecies salmonicida. So it can cause the classical Coroncolosis, that is the name of the disease that is caused by this particular bacterial pathogen. And for carps, it can cause the carp erythrodermatitis. For its distribution, it is distributed in cold to temperate zones. So it is not usually reported in tropical countries. And for its management, there is a vaccine available for this particular Aeromonas species. And it has no zoonotic potential. So Coroncolosis is a serious septicemic bacterial disease of fishes, and this is found principally in salmonid fish. So the common name of the disease is derived from the presence of blisters or furuncles on the surface of the chronically infected salmonids. So the main clinical manifestation of the Coroncolosis disease can be seen on the skin of the affected species, particularly the salmonid species, and this is described to be the presence of furuncles or blisters. The causative agent, again, is the Aeromonas salmonicida. So during bacterial culture, so after about 24 hours, the growth period, the colonies are about the size of a pinpoint. So for the description of the colonies of Aeromonas salmonicida, so they have a brown pigmented color appearing after growing for 48 to 72 hours. So we also have another bacterial disease, the Edwardsiellosis. This is caused by Edwardsiella tarda, piscida, and the angularum. It can affect various freshwater and marine fish, such as tilapia, pangasius, and eels. So it is global in distribution, and the management includes vaccines. It's standard management. The standard management can either include antibiotics, and the vaccines are also available. The Edwardsiella tarda is of zoonotic potential. We also have the another species of Edwardsiella, the Edwardsiella ectaluri, which can cause enteric septicemia of catfish, or the ESC. For its host range, this includes pangasius and tilapia, or the Ocricomis niloticus, and these are present in tropical countries. We also have catfish, the farm-raised catfish or Ectalurus punctatus. So in tropical countries, this is reported in Vietnam, and in US, this is reported in Florida. So for the management, standard management includes the use of antibiotics, and vaccines are also available for this particular bacterial disease. We also have the Yersinia rockeri, which causes the enteric red mouth, or the ERM. It mainly affects rainbow trout and other salmonids. It is global in distribution, and diagnostics include a standard method and the presence of a yellow feces. Management includes standard method. Management can be done through the use of antibacterials, and the vaccines are also available. So from the name itself, the main clinical manifestation is seen in the mouth of the rainbow trout. So for the main clinical manifestation of the enteric red mouth or the Yersiniosis, there is darkening and hemorrhage of the mouth, the skin, the anus, and the fins. For the chronic signs of Yersiniosis, this includes inappetence, exophthalmos, swelling, and degenerative changes of the internal organs. So this is rainbow trout, showing the clinical signs of enteric red mouth disease. So in letter A, there is darkening of the skin. There is also enlarged abdominal valley and hemorrhages in the dorsal fin. So this dorsal fin. So for the letter B, there is hemorrhages in and around the mouth. And for letter C, there is enlarged and black spleen and reddened intestine. So this mainly affects not only the mouth, but also the other parts, such as the fins and the belly, as well as the intestine. So that is why this particular disease of the rainbow trout is known as the enteric red mouth. This is a salmon with Yersiniosis displaying a swollen spleen. So ito yung black. And discolored liver. For the diagnosis is isolation and identification of pure cultures of the organism. And fish that survive remain carriers and may cyclically shed the bacteria. For the prevention and control of Yersiniosis, so this includes the population of the infected fish and avoidance of introduction of the infected fish to the farm. There is also the preventive vaccination. It's the usual procedure in endemic areas. Treatment, so this can be treated with antibiotics, which should be based on sensitivity test, and the therapy should be continued for at least 14 days. So we also have the Sodomoniasis. So this particular bacteria can cause different diseases depending on the species that it will affect. So for example, the causative agent, which is Pseudomonas anguilliseptica, can cause this what we call Sicketon BU in the eels. It can also cause red spot disease in elvers and winter disease in sea bream sparrows aurata. So for the host range, these are the host range of the Sodomoniasis. So the ones in red are present in tropical regions, and these include tilapia, the carp, and the silver carp and the big head carp. So for the management, Pseudomonas anguilliseptica can be cured by increasing the water temperature to 27 degrees centigrade for 2 weeks without antibiotics. So this particular pathogen is sensitive to changes in the temperature of the water. So this particular management practices can be used in order to cure this particular type of bacterial pathogen. We also have another gram-positive bacteria affecting fishes, the Mycobacteriosis, which can cause this what we call fish tuberculosis. And the species of mycobacteria that causes TB in fishes are Mycobacterium marinum and the Mycobacterium fortuitum. In tropical regions, it can infect tilapia, catfish, cyprinids, and snakehead. It is global in distribution, and for its diagnostics, since this is a Mycobacterium species, so the media that can be used is a special media in order to grow this particular bacteria. And the stain is Zeal. The stain that is used is a Zeal-Nielsen stain. For the management, this particular type of bacterial disease cannot be cured with antibiotics. It has zoonotic potential, so it can infect humans. We also have another type of mycobacteriosis that is caused by Nocardia asteroides cerulae. So Nocardia asteroides can infect various marine fishes. It can also infect shellfish, particularly the oyster and the mussel. And the ones that infects this particular species is the Nocardia crassostraceae. So this, for the management, it cannot be cured with antibiotics. So this particular type of bacteria is hardy, and it cannot be cured with antibiotics. So unlike the first one, this particular bacteria is of no zoonotic potential. We also have the Streptococcosis, Streptococcus agalaxiae. This particular bacteria can infect both freshwater and marine fish species, particularly in tropical region we have the tilapia, and for other regions we have the catfish and the rainbow trout. It is reported in Thailand, in Japan, Korea, and other regions. For the management, there is a vaccine that is available for Streptococcus ini. It can also be of public health significance. It can be zoonotic. We also have the Lactococcus garvae, which can infect the rainbow trout and the marine fishes, Japanese yellowtail, and the gray mullet. For the management, so increasing the the temperature of the water can be opted as a management intervention in cases of outbreaks. And there is also a available vaccine for this particular bacterial disease. We also have the Aerococcus viridans, which can infect the crayfish, lobsters, and it has uh, no zoonotic potential. Another is the Flavobacteriosis. This particular bacteria, the Flavobacterium brachyphyllum, can cause bacterial gill disease or the BGD in cold water, cold temperatures. In tropical regions, it can cause columnaris disease. Columnaris disease is caused by the Flavobacterium columnari. So this Flavobacterium columnari can infect tilapia and cyprinids, and there is a vaccine available for preventing this particular type of bacterial disease. And we also have the infection with intracellular bacteria. Example of intracellular bacteria that is present in tropical region is the Francisella noatunensis. Chlamydia species are also examples of intracellular bacteria that can infect salmonids. So Francisella noatunensis can infect tilapia, and these are the different regions where this particular disease are being seen or are reported. And this particular pathogen is of no zoonotic potential. Zoonotic fish pathogenic bacteria from warm water systems. So this include these bacterial pathogens can be of public health significance because they are considered to be zoonotic. So example of this are Streptococcus, Agalaxia, that mainly infects tilapia, Streptococcus enyei. We also have the Edwardshella tarda, Vibrio Vulnificus in eels, Photobacterium Damsel in marine fishes, Mycobacterium marinum that mainly infects tilapia in tropical regions, and the Mycobacterium fortuitum that infects the ornamental fishes. So it's highlighted here, that hygiene is very important in order to prevent the infection that may happen, or the infection from fishes towards the animal handlers or towards human. So these are two examples of contact zoonosis from fish. So when we say contact zoonosis, this particular bacterial pathogen can infect humans by way of contact. Contact with the surface of the fish that is infected with this particular zoonotic pathogen. So example of this is the Vibrio Vulnificus biotype 2. It can be zoonotic. It is a zoonotic pathogen of fishes, and it can cause fasciitis necroticans in immunocompromised eel farmers, and this can be transmitted by contact to the infected fish, particularly eels. So for the treatment in humans, this includes surgery, antibiotics with the use of this particular antibacterial agents. For the Mycobacterium marinum, it can cause a swimmer granuloma in humans. So take care, maybe missed. As cultured at 37 degrees centigrade in hospitals, and no growth, no 30 degrees centigrade, no is optimum for its culture uh, in the media. So we also have here some relevant bacterial problems in cultured warm water ornamental fish. So in koi and goldfish, they are usually infected with Aeromoniasis species. We also have the Vibrio Vulnificus in spa fish. We also have the Edwardshella ectaluri in zebrafish. Yersinia rockeri, Pseudomonas fluorescens in goldfish. Mycobacterium marinum in Fortuitum in goldfish, and Nocardia asteroides in freshwater and ornamental fish. So diagnosis of fish bacterial diseases can be done through isolation of the bacterial pathogen and identification. This can be done through biochemistry and also RNA typing, diagnostic PCR, so of course confirmatory, serological field test through the use of ELISA, and we also have the protein method. For sensitivity testing, we are using the antibiogram. The bacterial diseases should also be identified whether that particular disease is primary or secondary infection. Uh, Primary or secondary infection of the fishes. Prophylaxis. So fish vaccines can be used as a prophylactic measure in order to prevent the development or the infection of these pathogens to fishes. So these are the different bacterial pathogens wherein vaccines are available. And the one that is highlighted in red, those pathogens are present in tropical regions. So the pathogens can be, the vaccines rather, can be administered by injection, through immersion, by bath, and through per os or per oral through the feeds. For the summary and conclusion, so there are many bacterial aquaculture diseases worldwide, of which many relevant for tropical regions. So some of the pathogens may be contact zoonotic. When we say contact zoonotic, they can infect the animal handler by handling by direct contact with the infected fish. So good hygiene is very important for aqua farmers, field technicians, and processors handling the fish. There should also be proper diagnosis of bacterial diseases. So the diagnosis can include isolation, identification of the bacterial pathogen. So many of the diseases can be prevented by good management. So when we say good management, that includes the biosecurity and the maintenance of the water quality. And management can also include the use of appropriate vaccines. So there are different bacterial pathogens wherein vaccines are already available that can be used in order to prevent the development of that particular disease. So in case antibiotic treatment is necessary, we recommend to always make an antibiogram. So we have to identify whether that particular bacterial pathogen is sensitive or resistant to a particular antibiotic that we are using. So countries pay attention to the list of bacterial pathogens. So uh, we have mentioned those different diseases and different bacterial pathogens that are present in tropical regions, temperate regions, and cold regions. So for Philippines, for example, those listed in red are those diseases or those bacterial pathogens that should be monitored in order to prevent uh, potential outbreak the aquaculture industry. So we are done with the bacterial diseases of aquaculture. So meron kayong question dito na part. So I will just convert this into PDF and upload in our VLE.